Doctors, dietitians, medical professionals, you have a dilemma, and that dilemma is that your patients are Googling everything under the sun. Dr. Google can be a bit of a problem sometimes, and here to talk to us about the problem of Google with regards to fertility is Debra Langley. Debra, thank you so much for joining me on scottcundill.com.
Thanks, Scott. It's really great to be here, and you nailed it. Absolutely. Healthcare practitioners are faced with Googling patients on a daily basis that come to them thinking they have all the answers. And sometimes when it thinks to come to fertility, it's not only the patients, but some of the healthcare practitioners themselves do a bit of Googling because I think they feel fertility is a bit out of their scope of practice sometimes as well.
Okay, that's interesting. So Dr. Google is available for doctors as well and various healthcare professionals. That's good to know. I don't feel quite so bad every time I use Google. Now, specifically for doctors, though, it is a dilemma because people are getting crazy information. Standing on your head for 20 minutes in order to get pregnant, get into some weird contorted yoga positions. Maybe they work, maybe they don't. Maybe a little bit of both. But I think there's a slightly better way. And I'd love to hear a little bit more about the better way.
Absolutely. We've just launched a really new program called Supreme Fertility in South Africa, and it's brand new. It's only been available for about 3 to 6 for the last 6 months appropriately. And what we've tried to do is look at this whole environment that affects fertility. So that includes your diets, your lifestyle, drugs and supplements. And we start off this whole process as well by looking at a patient's, both the male and the female DNA, to try and pick up any genetic variants in this, because we have found that about 50% of infertility cases can be linked to some kind of a genetic variant as well, or a change in the patient's DNA makeup.
Okay, so you say this is quite a new thing, looking at DNA and looking at gene support, because in your article, you speak quite a lot about this, and it's interesting to know. So effectively you're saying, okay, standing on your head is one thing, but if you've got an underlying genetic condition or you need gene support, that is something that needs to be dealt with in a very different way. Take us through the kind of DNA gene support process.
Absolutely. So we look at basically the genes that affect male and female fertility in some kind of way. And we look at 15 areas specifically, and we're looking at things like blood clotting, thyroid health. We're looking at hormone balance, methylation, detoxification, oxidative stress, calcium and iron balance levels, omega-3, etc., in those kind of categories, and the genes that fall within those categories. And sometimes just by finding gene variants, it can lead a patient or the healthcare practitioner's diagnostics, and they can also have certain tests and stuff done, which can potentially highlight problem areas in a lot of these different fields, which could be affecting the patient's fertility, like in the long run as well.
So this is an interesting point. Are you saying that what you are providing and this new kind of, I don't know what the correct term is, not therapy, but this process, if you don't mind me calling it from a layman's perspective, this process supports doctors and therapists and dietitians. It's not there to kind of replace them.
No, absolutely not, because our program is only offered through registered Supreme Fertility practitioners. So we rely on the expertise of the professionals that are joining our platform. Because of the DNA testing, you have to have the medical background, the patients have to be guided, they need to have further blood work, etc. done. So it is only available through registered healthcare practitioners, and that's why we're really trying to grow our scope and broaden our network of practitioners, like across the country in general. And what it really does, because this whole fertility field, healthcare practitioners really thought it is only the domain of specialists. So we have tried to put through protocols and steps, and we really support our practitioners by giving them a step-by-step protocol, guiding them through the process. We give them training on how to interpret the DNA test results, etc., as well as a kind of feedback they need to be giving the patients. What kind of questions should they be asking regarding their diet, regarding their lifestyle, the drugs and supplements. Also something people forget about on a continuous basis is how important things like chronic medication and daily supplements that people could be taking that could also be affecting their fertility that they wouldn't have even thought about in the long run as well. So we do guide them step by step on board. We give them training and to show them that this field of fertility is something that they can add to their practice and expand their service offerings to their clients as well, and not something that they really have to always feel like they have to refer on to a specialist. So we're not replacing the specialist at all. It's really a kind of, the service that we're offering is supportive. So even if couples do intend to go for IVF treatments or artificial insemination, whatever it may be in the long term, this 3-month process that we're going to put them on will help even increase their chances of success with those fertility procedures in the long run as well. So it's very much complementary. So we're not replacing any kind of experts, and we're trying to attract them and get them on board with us in this process as well, and to give them a few more service offerings to add to give their patients the options as well. Because when you're looking at fertility, a lot of the time when it comes to IVF and things like that, some people don't even know that for a complete full IVF package, it can cost the patients up to 90,000 Rand for a treatment, and there's no guarantees, there's no doctor or practice that can give 100% success rates there. So by optimizing this whole fertile environment, we can help these patients, help them to become healthier, identify any kinds of problems in their genes, and initially help to increase the success rates. Because what we want to do is help these couples have healthy babies at the end of the day.
And I can see you super passionate about that. And I think that shines through, and it's so important. So you work with registered professionals that work with Supreme Fertility, and they can add this extra piece of the puzzle instead of simply going, okay, well, you need to see a specialist, and that's going to be a very expensive process. Would it be fair to say that what you're offering is the 3-month program is more a kind of, before you jump the gun and say, okay, you need to go see a specialist, which could be very expensive. You could go IVF, et cetera, there is this option where we can work together. Me, the doctor, I'm not the doctor, but pretend I am. Me, the doctor, or the dietitian, or the medical practitioner, I can work with you, the patient, working with the Supreme Fertility guidelines and genetic support, and say, okay, let's try and do this together before you have to take this kind of rather invasive treatment.
Absolutely. While we always say it's a 3 to 6 month program, because it takes about 3 months for that egg and sperm to reach full maturity. And in that time, if they're working with a practitioner and we guiding and recommending the right kind of supplements, making the right kind of dietary changes, finding any kind of deficiencies that may exist, they're giving the body the time to correct these imbalances. And in that 3-month period, by optimizing this whole environment, the couple may be able to fall pregnant without having to take that further step. So if we do get to the point where we feel that they should still go and see a specialist, we do recommend and refer them on like that as well. But we have seen really good success rates as well, which is quite exciting to see. So it can, in the long run, save the patients quite a bit of money as well, that they might not need to go to that step and go for that expensive route of all the IVF procedures and things initially. So it's really just giving them a 3-month period, optimizing the whole fertile environment. They're going to be healthy at the end of the day as well. So there's not really any side effects to the program at all. So it is 100%, it's going to just be complementary to any kind of procedure that they intend doing.
So tell us about the procedure itself then, Debbie. Tell us about what is entailed in those 3 months, a quick summary. So doctors and healthcare practitioners, they can say, okay, is this hocus pocus, or is it newfangled, new technology, gene therapy? Take us through the process so we can understand that it's scientific, it's medical, and it actually has specific results that have been proven. Give us that story.
Okay, well, the good news is we start by collecting both the male and female DNA, and there's no pain involved, no needles, no blood for all those squeamish patients and things like that. So it's just a mouth swab. So it takes about a minute. We collect their DNA samples and it goes off to the labs. And it will take the patients about 3 to 4 weeks to get those DNA results back. And that's when they schedule a feedback session with the healthcare practitioners that sit with them for about an hour to an hour and a half and analyze their DNA particularly to try and pick up any kind of variants. They may then recommend the patient for further blood testing and blood work if they suspect any kind of deficiencies or problems in certain areas. We make recommendations. We have formulated 4 specific fertility supplements ourselves to help support some of the most common gene variants we have seen. Unfortunately, it's not going to be the only supplements the patient may need, depending on their own DNA test results, etc. We've also got a little patient booklets covering everything about fertility. So we walk both the male and the female through male lifestyle changes, female lifestyle changes, dietary changes, etc. There's lists of drugs and supplements that they need to be careful, look out for that. And then, the practitioner will sit with the patients, and we give them guidelines and a whole lot of questionnaires and things. And there's a whole, a variety of things in patients' diet and in the environments that can also be influencing fertility. So we really just walk them and train them and show them what kind of questioning that they need to be asking the patients to try and identify any of these potential risk factors that they could be exposed to in the environments.
It sounds like a fantastic alternative, and I love the way that you work with the medical practitioners as well. So my final question then, Debbie, before we talk about specifically, about the company itself, tell us a little bit about success rates. Do you have any? You've obviously got a lot of case studies and good stories, but can you just give us an idea of the success of the program?
Sure, Scott. If I'm thinking offhand, I can. The first story that I'm thinking of that comes to mind is Cindy Pullen. She's one of our patients. And during the course of last year, she went to her gynae. They've been battling to fall pregnant for a while. And he said to them that they would never be able to have a baby with her own eggs. And he suggested they go the route of finding an egg donor, etc., which is not really an option that they wanted to do. And so they decided to come on board and try our Supreme Fertility program for 3 months. At the end of the 3-month period, they did still opt to have an IVF treatment, but I'm very excited to announce that little baby Yannick Pullen was born a few months ago as well. So that's really the kind of some success stories that we've seen. So exciting things to see like there as well. And the good news is that she managed to have this little baby with her own eggs naturally. So just by optimizing that whole environment, they were able to use one of her own eggs at the end of the day. So she didn't have to go the route of finding an egg donor.
Wonderful. So tell us a bit about Supreme Fertility as a business, and where can people get hold of you?
Okay, sure. If I can just very much sum it up. So it is a 3 to 6 month program that includes the DNA testing, and it's specifically aimed if the healthcare practitioners out there have any patients that have been diagnosed with unexplained infertility, where all the physical causes of infertility have been rooted out. So, and even for couples that are planning on starting a family, it's a great program to recommend, because they're going to have healthier egg, healthier sperm, and ultimately a healthier pregnancy and a healthier baby at the end of the day as well. Also, for those planning on IVF treatments, if they're having recurrent miscarriages, and then again, great for your older couples, and then where finance is a problem, where they can't afford these more expensive treatments as well. So it's a step-by-step. It is through healthcare practitioners. You're only available through our registered network of Supreme Fertility healthcare practitioners. And if there's anybody listening that would like more information about the program, who wants to come on board and become a Supreme Fertility practitioner, they can visit our website at www.supremefertility.co.za, or send an email to info@supremefertility.co.za. I'm going to just quickly repeat that. So it's www.supremefertility.co.za, or send an email to info@supremefertility.co.za. Yeah, and we're growing our network of healthcare practitioners, and we're looking for interested practitioners and dietitians and pharmacists that want to come on board and join us and just expand their realm of services to their practices, to their patients, that they can offer them and help support them at the end of the day to have healthy babies, which is what it's all about in the long run.
Absolutely, Deborah Langley. Thank you so much for joining me on scottcundill.com.
Pleasure. Thanks for having me.